Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your life. Today, let's talk about that heavy feeling of losing control. You wake up, and before the day has even started, your mind is already running ahead of you. Messages, bills, family pressure, health worries, work deadlines, conflict, bad sleep, social media, food choices, symptoms in the body, thoughts that keep coming back. You may think, I know what I should do, but I cannot seem to do it. Or, my life is moving, but I am not the one steering it. Look at that sentence carefully. I am not the one steering it. That is the key. Feeling out of control is not only about having too many responsibilities, it is also about the brain losing a predictable structure. And when the brain loses structure, it starts searching for danger. Why? Because the brain is designed to protect you. When life feels chaotic, the nervous system can shift into threat mode. Your heart rate may rise, your muscles may tighten, your sleep may become lighter, your decisions may become more impulsive. Your emotions may feel bigger than the situation in front of you. So where does discipline enter the picture? Not as punishment, not as harsh self-criticism, not as becoming perfect. Discipline, medically and psychologically, is better understood as repeated self-directed action. It is the practice of choosing small, planned behaviors even when your mood is not cooperating. It tells the brain, there is a pattern here. There is a next step. I can influence something. Ask yourself, when you feel out of control, what do you usually do? Do you scroll more? Do you delay tasks? Do you skip meals? Do you stay up late to reclaim time? Do you avoid calls, avoid exercise, avoid decisions, then feel even more trapped? This is common. It is not a character defect, it is the stress system trying to get quick relief, but quick relief can become a loop. Avoidance reduces discomfort for a moment, then increases the size of the problem tomorrow. Discipline breaks that loop by giving your brain evidence, not a motivational speech, evidence. You make your bed, you drink water, you take your medication as prescribed, you walk for 10 minutes, you answer one message, you write down the next appointment. You prepare one simple meal. Each action is small, but the signal is powerful. I can act. That signal is connected to something psychologists call perceived control, the belief that your actions can influence outcomes. Studies across mental health research repeatedly show that people who feel more capable of influencing their situation often cope better with stress. This does not mean you control everything. You do not. But you control some things, and that some matters. Look at the emergency department. When a patient arrives in distress, we do not control every variable immediately. We cannot instantly reverse every disease process, but we create order. We check airway, breathing, circulation. We measure vital signs. We place monitors. We start an IV. We ask focused questions. We do the next correct step. Why? Because structure saves mental energy and protects against panic. Life outside the hospital is not the same as emergency medicine, but the principle is similar. When chaos rises, create a sequence. Do this. Stop asking, how do I fix my whole life today? That question is too large. Ask, what is the next controllable action? Why does this work? Because the brain handles concrete actions better than vague fear. Get healthy is vague. Walk after lunch for 10 minutes is concrete. Be more organized is vague. Put tomorrow's clothes next to the bed is concrete. Stop being anxious is vague. Do 4 slow breaths and write one task on paper is concrete. Discipline becomes helpful when it is built around anchors. Start with sleep, movement, food, medication, and time. These are not glamorous, but they are biologically meaningful. Sleep affects mood, attention, reaction time, blood pressure, hunger hormones, and decision making. Adults generally need at least 7 hours of sleep, though needs vary. If your sleep is constantly short, your brain has less ability to regulate emotion, so start with a sleep discipline. Set a wake time. Keep it as steady as possible. Get light in the morning. Reduce caffeine late in the day. Build a wind-down routine. Pay attention to snoring, choking during sleep, morning headaches, or severe daytime sleepiness. Those can point to sleep apnea or another sleep disorder, and they deserve professional evaluation. Then look at movement. Do not make the first goal dramatic. Start where your body is. If you are inactive, walk 5 to 10 minutes. If you have chest pain, fainting, severe breathlessness, or a heart condition, speak with a clinician before increasing activity. But for many people, regular physical activity can help mood, anxiety symptoms, sleep, insulin sensitivity, and cardiovascular health. How? Movement changes body chemistry, reduces muscle tension, improves sleep pressure, and gives the mind a physical experience of progress. You are not exercising only to change your body shape. You are training your nervous system to leave frozen mode. Now look at food. When people feel out of control, eating patterns often swing. Some people eat very little all day and overeat at night. Some graze constantly. Some rely on sugar and caffeine because they are exhausted. Do not begin with shame. Begin with rhythm. Eat protein and fiber earlier in the day if you can. Keep water visible. Prepare one basic meal option that does not require much thought. Why? Because discipline reduces decision fatigue. The more decisions you must make while stressed, the more likely your brain chooses the fastest comfort. Medication discipline also matters. If you take medications for blood pressure, diabetes, seizures, asthma, depression, anxiety, or any chronic condition, take them as prescribed. Do not stop suddenly because you feel better or because you are frustrated. Some medications can cause withdrawal symptoms or dangerous rebound effects. If side effects bother you, call your doctor or pharmacist. Ask directly, can this medication affect sleep, mood, appetite, sex drive, energy, or concentration? Also ask about interactions with alcohol, cannabis, supplements, and over-the-counter sleep aids. Discipline is not blindly following. Discipline is participating in your care with accuracy. Let's go deeper into the mind. One evidence-based therapy approach, behavioral activation, uses a very practical idea. Mood often follows action, not the other way around. Many people wait until they feel motivated before doing meaningful things. But depression, burnout, grief, and chronic stress can reduce motivation. So if you wait for motivation, you may wait too long. Behavioral activation says, schedule actions connected to values, routine, and pleasure, then observe what happens. You do not need to feel ready. You start small and repeat. Ask yourself, what kind of person do I want my actions to vote for today? Not in 10 years, today. If you value being a dependable parent, make one dependable action. If you value health, make one health-directed action. If you value peace, protect one quiet moment. If you value faith, reflection, learning, service, creativity, or repair in relationships, put one behavior on the calendar. Discipline turns values from ideas into scheduled reality. But be careful. Discipline can become unhealthy if it becomes rigid, extreme, or self-punishing. If your routine collapses every time you miss one step, it is too fragile. Build flexible discipline. Missing a workout does not mean the week is ruined. Eating one snack does not mean you failed. Sleeping badly one night does not mean you give up the routine. Use the phrase, return at the next step. Not Monday, not next month, the next step. Why is this so important? Because the loss of control often grows from all or nothing thinking. If I cannot do it perfectly, I will not do it. That thinking feels protective, but it steals progress. Replace it with minimum standards. On a strong day, walk 30 minutes. On a hard day, stand outside for 2 minutes. On a strong day, clean the kitchen. On a hard day, wash 1 cup. On a strong day, journal a full page. On a hard day, write 1 sentence. Today, I will do the next correct thing. This is not lowering your life. This is keeping the pathway open. Pay attention to your environment. Discipline is not only willpower inside your head, it is design. Put the phone outside the bedroom if nighttime scrolling is harming sleep. Place medication near a daily routine if safe and away from children. Keep shoes near the door. Put fruit or water where you can see it. Remove one trigger from the room. Add one helpful cue. Why fight your environment all day if you can adjust it once? Use time blocks. Start with a morning anchor and an evening anchor. In the morning, do 3 things before the world enters your mind: light, water, and one written priority. Look at sunlight or bright outdoor light if possible. Drink water. Write one priority that would make the day feel less chaotic. Not 10 priorities. 1. In the evening, close the loop. Prepare tomorrow's first step. Reduce stimulation and give your brain a signal that the day is ending. Now let's address severe loss of control. If you feel like you might harm yourself or someone else, seek urgent help immediately. Call emergency services or a crisis line in your country. If you have chest pain, signs of stroke, severe shortness of breath, confusion, fainting, uncontrolled bleeding, severe allergic reaction, or sudden severe symptoms, do not try to discipline your way through it. Get emergency care. Discipline supports health, but it does not replace medical evaluation. Also, if the feeling of losing control comes with panic attacks, trauma, flashbacks, compulsions, substance use, eating disorder behaviors, mania symptoms like very little sleep with high energy and risky decisions, or depression that lasts more than 2 weeks and affects daily life, talk with a mental health professional. You may need therapy, medication, medical testing, or a combination. During pregnancy, after childbirth, with chronic disease, or after a major diagnosis, get support early. Hormones, inflammation, pain, sleep disruption, and medications can all affect mood and self-control. So how do you begin today? Do not build a full life plan tonight. Choose one controllable routine for 7 days. Make it small enough that you can do it on a bad day. For example, wake up at the same time, take a 10-minute walk, write the top task, take medication correctly, or start a bedtime routine. Track it with a check mark. Do not write an essay, just mark it. The check mark matters because the brain learns through repetition and reward. After 7 days, ask, what changed? Did my mood improve a little? Did I sleep better? Did I avoid one impulsive decision? Did I feel less helpless for a few minutes? Look for small evidence. Discipline grows when you notice evidence. Then add the next layer. Remember, the goal is not to control every part of life. That is impossible, and chasing total control can increase anxiety. The goal is to become trustworthy to yourself. When you say, I will do one small thing, and then you do it, you rebuild self-respect. When you rebuild self-respect, your nervous system receives a new message: I am not powerless. Look at your life like a patient in triage. What needs attention first? Sleep? Movement? Food? Medication? Money? Relationships? Pain? Addiction? Loneliness? Choose the area with the highest impact and the smallest starting action. Do this today, not perfectly, consistently enough to teach your brain a new pattern. Feeling out of control is frightening, but it is also a signal. It tells you that your system needs structure, support, and a next step. Discipline, when it is kind and realistic, gives you that next step. Start small, repeat it, protect it, return when you drift, and if symptoms are severe or persistent, bring in professional help. Take care of yourself, take care of the people around you, and keep building the kind of health that can stand under pressure. I'll see you in the next topic.